When I was first told my surgery was coming through, I was very relieved. I'd been waiting a long time, and I'd actually been to an ER on a few occasions with my issue, which was abdominal. But I was elated. I was ecstatic, but also a bit concerned, just with how I was going to go through with it. My understanding of being surgery fit was like not fat. You had to be super ready to go, almost Iron Man-ish, but that wasn't the case. It's a holistic approach, I feel, of just being as fit as you can be, stopping any bad habits you may have, like smoking, etc., and making sure your mind's on the same page as your body when you're having the operation. SurgFit helped me by addressing some issues that I had, which I didn't realise that I had, and that was my diet was problematic, even though I couldn't eat properly. What I was doing wasn't right, and they gave me some simple tools able to overcome that, not be afraid of the food, and also the mental state of just being able to just keep calm. Everything's going to be okay, and you're never alone. And also being able to clear my mind prior to the surgery, because I think your mind needs to be there, especially for the recovery period. You're not in hospital as long as you used to be, and that kind of has probably a feeling of worry, and that how can something so dramatic happen to my body, and yet within 3 or 4 days I'm home. I was in hospital for 4 days, which was pretty good considering what I had done. And again, I put that down to the SurgFit giving me the right tools to go in with, and obviously while I'm actually in hospital looking after myself, and while I'm out as well. If I was to give any advice to any patient prior to the surgery, is to do the SurgFit. I know it can look a little bit silly and maybe gum flappy and just chatting beforehand, but I do see it as an invaluable tool for your physical self and your mental self before you go into the operation. Obviously the operation is out of your control, but everything else is in your control, and obviously being able to look after yourself after the surgery and get back into life as quickly as possible, I think is your number one